Hey everyone, Dr. Backbencher here. So today we'll be studying the diseases of the lacrimal gland, right? The gland which produces tears. We will be studying the inflammation of the gland, that is Dacryoadenitis. We will be studying conditions in which there is less production of tears, and we will be studying conditions in which there is more production of tears, right? Let's get straight into it. Dacryoadenitis first. So Dacryoadenitis has two types, acute and chronic. Acute Dacryoadenitis is the acute inflammation of the lacrimal gland, right? And when you hear the word acute inflammation, it should bring those 5 cardinal signs of inflammation: redness, swelling, pain, loss of function, because of course if it's inflamed it can't produce tears, and etiology, the cause of why a lacrimal gland will get inflamed. It could be because of viral infection or a bacterial infection. And the common viruses which can cause Dacryoadenitis include the Epstein-Barr virus, EBV, or even mumps virus can cause Dacryoadenitis as well. And bacteria, staph can infect the gland and cause Dacryoadenitis, as well as Neisseria gonorrhea. Neisseria gonorrhea can also infect the lacrimal gland. So features: painful, redness, swelling, as we said. Then there's this very distinctive feature about Dacryoadenitis is that the guy has a S-shaped curved eyelid, right? So let's draw a diagram here. Let me show you how it's an S shape. Let's say here's the eye of someone, right? And here's the nose, of course. We know that the lacrimal gland is up here, right? The lacrimal gland is up here and it's producing tears. So if something were to happen to this gland, if it gets inflamed, it'll swell, right? It'll cause swelling, and this gland will grow big and big and big, and it'll put pressure on the eyelid up here. As a result, it will bulge the eyelid and it'll press the eyelid towards the inside. And the new shape of the eyelid would look something like this. It'll be normal here, it'll be normal here, and then because of the inflammation, it will kind of bend towards the inside. Right? It'll come back up here. So see, there's this kind of S-shaped form, right? So acute Dacryoadenitis and even chronic will have this inflammation, this swelling, which will lead to an S-shaped curved eyebrow. And one of the other symptoms are proptosis, right? Proptosis is the bulging of the eyelid. Of course, there's the eye, right? And there's the eyelids over here, right? And there's the gland here. If it gets big, it'll kind of push it towards the outside. It will push the eyeball towards the outside, causing proptosis. And probably there'll also be pus production because, of course, it's acute inflammation. Acute inflammation features neutrophils, which will cause pus production. Treatment is by treating underlying cause. Underlying cause include viral causes and bacterial infections. So exactly, we'll do that. We'll use antibiotics if it's bacterial, antiviral drugs if it's viral, analgesics to control the pain, hot fermentation to control the inflammation, right? Chronic Dacryoadenitis, right? Chronic Dacryoadenitis is the chronic inflammation of the lacrimal gland. Very similar to the first one, except for a few features. First of all, it's painless, right? The other one is painful. S-shaped eyebrow again, as I mentioned in the previous one. Proptosis again, because the gland is big and will push the eyelid out, the eyeball out. Eyeball movement restriction, because we have a big thing up there, right? We can't move the eyeballs as easily as we used to. Pus production is not generally seen because, of course, it's chronic inflammation, and the treatment is you have to treat underlying conditions, right? Just learn that sarcoidosis, Sjogren's syndrome, syphilis, and TB, they can cause chronic Dacryoadenitis, and by treating these conditions, chronic Dacryoadenitis can be cured. Then we have another condition called KeratoconjunctivitiS SICCA. If you want to impress the examiner, but if you want to learn it yourself, just call it the dry eye syndrome. Simple, right? Nothing so difficult about it. Even its name gives it away. People have dry eyes in this condition, right? So it's a chronic condition characterized by persistent dryness of eyes. Etiology. Now this is a very big topic, right? And there can be a lot of causes of dry eyes, right? For now, let's talk about what actually happens in a dry eye. So the problem in dry eye is that there is a disturbance of any of the 3 layers of the tear film, right? Remember the three layers of the tear film. They are the mucous membrane layer, which is the conjunctiva, actually. Then there is the aqueous layer produced by the lacrimal gland, and then there's the lipid layer, which is produced by the meibomian glands, right? So a problem in any three of these things can cause dry eye, right? And as I said before, that its etiology can be massive, right? Okay, let's have an example for a second. Let's say if a guy has a deficiency of vitamin A, right? So vitamin A deficiency, vitamin A is used for maturation of membranes, right? And if there is no vitamin A, there is a chance that their conjunctiva will not develop properly. As a result, one of the layers of the tear film is disturbed, which will lead to dry eye, right? Then of course we have the aqueous layer, right? For example, if there's Dacryoadenitis, right? There's an inflammation of the tear gland and it cannot produce tears. What will happen is that we have one of the layers, that is the aqueous layer, is disturbed, and there's not a proper tear film, which will lead to a dry eye syndrome, right? And then there can be, for example, we have a meibomianitis, right? Or we have a chalazion problem. What will happen is that there is no function of the meibomian gland, so we will have no lipid layer. We are disturbing one of the three layers of the tear film, which will again lead to dry eye syndrome. So it's massive, right? There can be a lot of reasons. Let's go towards these were the general underlying conditions. Let's actually go specifically into what could actually cause dry eye syndrome. So these are the few conditions, well, not technically few, these are a lot of conditions right here. Sjogren syndrome or any other autoimmune conditions, right? So let's say if a guy has an autoimmune disorder in which the cells attack the tear glands, right? The lacrimal gland. So of course there is no production of tears, and you're disturbing one of the layers of the tear film, and you're getting dry eye, right? So Sjogren syndrome is a disease in which there is destruction of both the salivary glands and the lacrimal gland, right, by our body own cells. It's autoimmune, and it will result into less production of the aqueous layer, which will lead to a dry eye, right? Vitamin A deficiency, as I described a few seconds ago, vitamin A is very necessary for maturation of epithelia, right? And one of the layers of the conjunctiva, the outermost layer of the conjunctiva, is a mucous membrane, right? It's actually an epithelium. And if you have vitamin A deficiency, they will not mature properly. They will not be in the proper shape. They will not be in the proper form. As a result, we will have a tear film instability because one of the layers is disturbed. And it will result into dry eye. Contact lenses can cause dry eye by disturbing all three layers, right? Parasympathetic drugs. If there is a drug which lyses or disturbs the parasympathetic system, because we know that parasympathetic system is the one which actually helps, which actually does all the secretion in the body. If you stop the parasympathetic system, you will not have tears. And you will not have tears, and it will result into dry eye. If you have a conjunctival scarring, right? If the conjunctiva is not proper, it's all scarred and ulcerated, and so the tear film will not be able to deposit properly on it, right? It will break, and as a result, there will be no tear film. There will be no proper tear film and dry eye. Again, tumors of the glands. If the glands are having tumors, they will not work properly. There will be no proper layer production, right? As a result, dry eye. Infections, right? Infections. Congenital alacrima is a condition in which there is less production of tears, right, by the lacrimal gland. Then there is idiopathic, right? Unknown cause. For whatever reason, the lacrimal gland is not doing its job. And secretomotor denervation, right? The lacrimal gland is not commanded by the parasympathetic autonomic nervous system because of some problem, right? Sensory deprivation, right? If the eye cannot detect its dryness, it cannot sense dryness, it cannot elicit a secretomotor reaction. It will not elicit a secretomotor reaction. So again, dry eyes, right? Refractive surgeries. There have been cases of people having refractive surgeries. For example, the corrective surgery of myopia. one of my friends had that, and they had dry eye for like 5 or 6 months, and blepharitis, because if their eyelids are not proper, if their eyelids are inflamed, when they blink, they will not be able to spread the tear film around properly. So blepharitis will also lead to tear film instability, and as a result, dry eye. Right. So many conditions. Right. You can even derive some of your own from your knowledge. So yeah, tear film instability and dry eye. Nothing so difficult about it. Clinical features include irritation, burning, and foreign body sensation, photophobia, stringy mucus discharge. Right. Stringy mucus discharge is a kind of discharge in which, like for example, if you dip your finger in honey and you pull it out, and it drops in the form of these long strings, right? The mucus discharge in dry eye is that kind of mucus discharge. It's stringy, right? And signs, what will you notice as a doctor, is reduced tears and a thinned tear film, right? Because its composition has been disturbed. So testing, right? Testing, well, usually in most cases, observation alone is enough, right, for you to form a diagnosis that this guy is suffering from dry eye. But if you really want to do tests, there is a test called tear film breakup test, right? So what happens in this test, that there are certain dyes, right, which are dropped onto the surface of the eye, right? It looks somewhat like this, and this dye then it's illuminated with a special kind of light, right? And normally what will happen is that this tear, this greenish thing is actually the illuminated tear film, right? And the tear film will stay intact for 10 seconds if the guy doesn't blink, right? The guy is not, the patient is specifically told not to blink. So if they keep their eye open for 10 seconds and the tear film is still intact, the guy is normal, right? But if the guy is suffering from a tear film instability, right? For example, in dry eye, what will happen is before 10 seconds are over, you will see these little breaks, right? You will see these little tears inside the tear film, right? And this will give us a confirmation that this guy has a problem in sustaining or making their tear film. And see, so fluorescein dye is placed in the eyes for testing. Normal breakup duration is 10 seconds or more. If it breaks up before 10 seconds, this guy has got dry eye, and that is a confirmatory test. Another very interesting test is called the Schirmer's test, right? In Schirmer's test, we have this little strip which is inserted into the eyelid. It looks like this. See, this is the Schirmer's strip, right? And it is typically graduated, like in millimeters, right? Here's a 0, for example. There's a 5 millimeter, right? And there's, let's say, there's a 10 millimeter here as well. So usually, when you insert this in normal people and put it like that, you leave it in place for around about 5 minutes, right? And in 5 minutes, because there's a tear film all over this place, and there's the gland, the lacrimal gland producing even more tears, this strip will absorb all these tears, right? And through capillary reaction, it will get wet, right? This wetting will go up and up and up, right? And after 5 minutes of time, if this guy is normal, what will happen is that this will be wet all the way to 10 millimeters, right? A normal guy. But if a guy has a problem of this gland right here, of the lacrimal gland, what will happen is that there will be less production of tears, and as a result, there will be less wetting, right? And what will happen is, instead of like 10 millimeters, the water, the tears will go, and it will mark around 6 millimeters, right? 6 millimeters is actually the threshold. So if there is 10 millimeters of wetting, it's normal. If it is less than 6 millimeters, we will call it dry eye, right? So Schirmer's test, Schirmer's strip right here, easy. Treatment of dry eye tear substitutes, right? There are many kinds. There are 3 or 4 kinds of tear substitutes. You can look them up in your book. Topical retinoids are are drugs which can help in the proper maturation and nourishment of the conjunctival layer. Then there's the reduction of tear drainage, right? Of course, if there is less production of tears, one way is that if you block one of those lacrimal canaliculi, right, and there will be no drainage, and as a result there will be more tears which will stay on the surface of the eye, right? So reduction of tear drainage system can also be a treatment of dry eye, and surgeries can also be performed to correct dry eye. So let's move towards excessive lacrimation, right? It's increased tear production, and it could be caused because of problems with the secretory system, that is the problem with the lacrimal gland, right? It's overproducing, or it could be a problem with the drainage system as well, right? So causes of excessive lacrimation, simple, right? Foreign body. If there's a foreign body in the eye, we will produce tears as a reflex. Psychological stimulation, right? If you are crying or out of pain or out of joy. Hyperthyroidism, I have no idea how that would do it. It's just bookish knowledge, right? Remember it. Cholinergic stimulation, or cholinergic stimulation is actually stimulation of the parasympathetic system, and we know parasympathetic system is the one which causes lacrimation. So if you stimulate the cholinergic system through drugs and stuff like that, it'll cause excessive lacrimation. Inflammation and stuff of like inflammation of the conjunctiva and keratitis, which is the inflammation of the cornea, it can also lead to excessive lacrimation. And crocodile tear syndrome is a bit interesting, right? Let's remind ourselves that the nerve which supplies the lacrimal gland, that same nerve also actually supplies the glands of salivation, right? The salivary glands. That is the facial nerve, right? The facial nerve supplies the submandibular and sublingual glands, not the parotid. Keep that in mind. And it also supplies the lacrimal gland. So there are certain kind of certain pathologies, certain conditions in which there is a damage of the facial nerve, and then when the facial nerve heals, it kind of links both of these pathways, the pathway of lacrimation and the pathway of salivation. As a result, crocodile tear syndrome occurs. In this syndrome, what happens is that you'll observe a patient who eats, and when they eat, they will shed tears, right? And because both of these pathways are connected, when they eat, they salivate, and when they salivate, when they salivate, they will produce tears as well, right? And that's crocodile tear syndrome. Simple as that. And it'll result in excessive lacrimation as well. Of course, it's excessive lacrimation. And yeah, I think that's it. It was a long lecture. Took me a lot to record. I hope you liked it. Like, subscribe, and share if you think it was worth it. And yeah, I'll see you in the next one. Thanks.